I'm Nyx Melody. I am a psychotherapist, a professor, and business consultant who lives here in New York City. I identify as a non-binary and trans femme person. My cancer journey started with an encounter, sexually speaking. I felt some pain in my scrotum. I went to urgent care. I would try to answer the questions as honestly as possible, particularly around my experience of my gender and my gender presentation. And I was always met with a lot of judgment and ridicule and a lot of invasive questions about my body, my safe sex practices, which I engaged in and was happy to answer, but always felt like things were just hyper fixating on the fact that I was a queer person. There was a spot on the questionnaires that I had to fill out that asked what my gender identity was, a spot that asked for my pronouns, but each space still referred to me as Mr. and my former last name. That felt really shitty. I had non-seminomatic germ cells, which is a pretty uncommon version of cancer, especially testicular cancer. I had a lot of gender dysphoria in association with my scrotum and testes. It was not something I've ever liked about my body. And so the idea of having one less and perhaps it being a smaller thing on my body was actually really appealing to me. So I just said, I don't want it. And his response was something to the effect of, most people's insurance doesn't even cover this. I just eventually folded and I was like, okay, fine, I'll get this testicular implant. I want to say there was probably about 5 different sizes and I was like, that one, the smallest one possible, that's what I want. So I thought that's what we had collaboratively decided, and it wasn't until days after the surgery when I was feeling well enough to kind of examine myself that I realized that the testicular implant was actually the one he said I should get, which was for a fully, like a full adult male. And I was so upset. I remember being in the shower and I just started sobbing and crying because I didn't want this in the first place. And now it's like 5 times the size of what I asked for and even bigger than what my natural testy was in the first place. Throughout my cancer journey, advocacy for myself was really all I had a lot of the time. I didn't feel as though healthcare providers were advocating for me, and so I really had to ask for what I wanted and needed myself. I am 6 years in remission. Every year go in for a checkup, but they're no longer doing the CT scans or the x-rays, just blood work and a quick check-in, which thankfully everything has consistently been normal. If I were to make recommendations to any provider, regardless of your level of competency and understanding of transness or queerness, is believe your patient. What they know about themselves and what they know about their bodies comes with a wealth of lived experience. The rampant and like emerging and evolving and multiplying anti-trans, anti-queer legislation is only making things worse. We're really seeing a rapid decline backwards towards the removal and restrictions of our rights as human beings, as legislation, healthcare, mental health. Many people who are trans are prescribed hormones to affirm their gender identity, and a lot of legislation in many states are limiting access to, especially on the basis of age, the ability to receive this life-saving medication In some states, providing any sort of gender affirmative treatment is becoming illegal, insofar that a doctor or even a licensed therapist could be at risk of losing their license simply by affirming that you use a different set of pronouns or use a gender identity label that's different than your sex assigned at birth. And because we often expect as queer and trans people to receive suboptimal medical treatment or mental health treatment in the first place, folks often would rather not do it. And because of that, they're at higher likelihood of not being screened for any type of cancer that a person could be at risk for developing. It doesn't only harm us. It also harms straight people and cisgender people. And we've seen this actually specifically with anti-trans bathroom bills, where now many cisgender women, many of whom are also straight, are being harassed and stalked while going into their bathrooms simply because they're not modeling the expectations of femininity. We're terrified, we're afraid, we have no idea what is in store or what to expect. And because of that, most folks are preparing for anything to happen, whether that's the need to leave this country to keep safe somewhere else that is more accepting or embracing of trans and queer identities. For some folks, unfortunately, that has also led to increases in folks taking their lives due to the fears that they have. I really wish that lawmakers would spend time getting to know their constituents. I would hope that the intentions of being a legislator and a politician would be to help and improve society and people, not to oppress or limit or harm specific groups of people, of which typically those legislators are not a part.